Hello and welcome to Golden Nuggets Health and Wellness Channel. I'm Dr. Elect Starr. Thank you for joining us for episode 2 of our series, Understanding Depression, From Awareness to Healing. In our previous episode, we discussed what depression is and how it affects millions of people worldwide. Today, we're going to explore something many people don't realize. Not all depression looks the same. There are several different types of depression, each with unique characteristics, causes, and treatment options. Understanding the differences can help people recognize symptoms sooner and seek appropriate support. If you enjoy this video, please like, subscribe, and share with someone who may benefit. Our opening scripture comes from Jeremiah chapter 29, verse 11. It reads, "For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope and a future." Even when depression clouds our vision and makes the future seem uncertain, God reminds us that our story is not over. There is hope. There is healing, and there is a future. Before we begin, please know that this presentation is intended for educational purposes only and is not intended to diagnose or treat any mental health condition. If you are experiencing symptoms of depression, please consult your physician or a licensed mental health professional for personalized care. If you are experiencing thoughts of self-harm, contact or text 988 immediately. Introduction. Many people think depression is one condition that affects everyone in the same way. However, depression exists on a spectrum. Just as physical illnesses can vary in severity and symptoms, depression can appear differently from one person to another. Let's look at some of the most common types of depression. The first type is major depressive disorder, often called clinical depression. This is one of the most common and most severe forms of depression. Individuals may experience persistent sadness, loss of interest in activities, fatigue, changes in sleep, appetite changes, difficulty concentrating, and feelings of worthlessness. Symptoms typically last at least 2 weeks and significantly interfere with daily functioning. For some people, getting out of the bed feels like climbing a mountain. Simple tasks can feel overwhelming. Another form is persistent depressive disorder, formerly called dysthymia. This form of depression is generally less severe than major depressive disorder, but lasts much longer. Symptoms may continue for 2 years or more. Individuals often describe themselves as always feeling down, chronically discouraged, frequently pessimistic, and emotionally exhausted. Because symptoms become part of everyday life, some people don't realize they're experiencing depression. Postpartum depression. Postpartum depression affects some women after childbirth. While many mothers experience temporary emotional changes known as the baby blues, postpartum depression is much more serious. Symptoms may include severe sadness, excessive crying, anxiety, difficulty bonding with their baby, feelings of guilt, and thoughts of self-harm. Seeking treatment early is extremely important. Mothers need support, not judgment. Seasonal affective disorder. Seasonal affective disorder, often called SAD, typically occurs during the fall and winter months. Reduced sunlight can affect mood-regulating chemicals in the brain. Symptoms may include fatigue, oversleeping, weight gain, low motivation, and social withdrawal. Many individuals notice improvement during spring and summer. Psychotic depression. Psychotic depression occurs when severe depression is accompanied by psychosis. A person may experience delusions, hallucinations, false beliefs, and distorted perceptions of reality. This condition requires immediate professional treatment and should never be ignored. Disruptive mood dysregulation disorder. This diagnosis primarily affects children. Symptoms include severe irritability, frequent temper outbursts, and difficulty regulating emotions. Parents often describe their child as constantly angry or easily frustrated. Professional assessment is important because these symptoms can significantly impact school, family relationships, and social development. Substance-induced depression. Sometimes depression develops because of alcohol use, drug use, medication side effects, and withdrawal symptoms. In these cases, addressing the substance issue becomes an important part of treatment. Depression related to medical conditions. Certain medical conditions increase the risk of depression. Examples include cancer, chronic pain, Parkinson's disease, multiple sclerosis, stroke, and diabetes. Living with ongoing health challenges can affect emotional well-being and quality of life. And last, bipolar disorder. Although bipolar disorder is not technically a depressive disorder, it includes episodes of depression. People with bipolar disorder experience periods of depression along with periods of mania or elevated mood. During depressive episodes, symptoms can resemble major depressive disorder. Proper diagnosis is essential because treatment differs from traditional depression treatment. Reflections. I want you to consider this question. Have you ever assumed someone's depression should look the same as everyone else's? Depression can be hidden behind a mask. It can appear as anger. It can look like fatigue. And it can look like isolation. Understanding the different forms of depression helps us respond with greater compassion and understanding. Repeat this affirmation after me. I am not defined by my circumstances. I am not defined by my diagnosis. There is hope for my future, and healing is possible. In conclusion, depression is not a one-size-fits-all condition. There are many forms of depression, and each person's experience is unique. The good news is that regardless of the type, help is available and recovery is possible. The more we understand depression, the better equipped we are to support ourselves and others. Thank you for joining us for today's Golden Nugget. In our next episode, we'll discuss the signs and symptoms of depression and how to recognize when someone may be suffering. If you found this video helpful, please like, subscribe, and share. Remember, creating a healthier world starts with you.